let's quickly talk about the indications for surgery. That's for people who have what lower GI bleeding. All right. So this simply means that when a patient comes to the hospital, and even when you are able to establish that the patient actually has a lower GI bleeding, you don't just rush to surgery. Okay, coming. All right. You don't just rush for surgery. Okay. There are some couple of things that you must see, all right, that will make you want to do surgery for somebody that has what lower GI bleeding, all right, and those are the things we are going to see right here. Okay, so indications for surgery for lower GI bleeding patients. All right, if you see that the patient has what hemodynamic instability, so that means the patient has bled so much, and basically the fluid volumes in the body have drastically reduced, right? You might just want to do a surgery so that you want to save a life too quick, okay? Then if there's a failure of what endoscopy or other techniques to arrest the hemorrhage, you might want to do surgery, all right? Because you can actually use what the endoscopy and other techniques, probably drugs and all that, just to stop the bleeding, all right? So if the bleeding does not stop with all these efforts, then all right, the last thing you might want to go for is a surgery. All right, if there's a recurrent hemorrhage after initial stabilization, so let me say the patient came to the hospital, you succeeded in trying to like stabilize the patient for a while, then even after the stabilization, you are now having what recurrent bleeding again. All right, you might just want to do a surgery. If there's a shock associated with recurrent bleeding, all right, if after some time, after a while, the patient now went into what hypovolemic shock, all right, you might want to do what a surgery. If there's continued slow bleeding with transfusion requirement exceeding 3 units per day, so normally if the patient is what bleeding, you are transfusing. If they are bleeding, you are transfusing, right? But if the thing is now too much, spanning for more than 3 days, you know that you can't continue what? You can't continue transfusing like that, right? Because this kind of blood transfusion also has its disadvantages, okay? Then another one is what? Okay, surgical options include segmental resection or subtotal colectomy, all right? So there's a strong tendency to delay surgery until the site is clearly localized, right? So you want to know the exact place that has the problem. You don't just open the patient up without being sure, all right, of the part of the lower gastrointestinal tract that is what affected, right? So those are the indications for surgery.